Hi, welcome to Health First. Today I'm here with Dr. Natalie Borodoker, who is an ophthalmologist. Hi, how are you?
Very good, thank you.
Thank you so much for joining me.
It's my pleasure.
I would like to start off by asking what influenced you to pursue a career in the medical field?
Um, it has been with me for so long that I can hardly remember. Possibly my grandmother, she was a physician. And when I was little, I was exposed to medicine through her. So I would say her at the most.
Tell me a little about your profession.
Ophthalmology is a wonderful field. It combines medicine, surgery, all the technology innovations. It's the coolest field in the world, I think. It has all the toys that we could play with while helping people see. And it's a very gratifying field, very gratifying.
Yeah. What do you like most about your profession?
Well, I think I like the fact that you get to continuity of care. You get to see people in a very nice outpatient setting, and yet it's still surgical. So uh, you get the best of both worlds.
Mhm. What is the biggest challenge in your profession?
Good staff. Well, that is challenging, but I think um, that as in medicine, it's challenging to get people to um, follow, to come on time, to um, I have trouble saying, there's so many challenges, but they're not the biggest. Um, um, I mean, compliance, I guess, compliance, because a lot of the illnesses are chronic and people don't really necessarily get lost to follow-up. These are older patients, and sometimes you see somebody who could have not had an issue, and then they're non-compliant for a couple of years and they lose vision. So that probably is very upsetting, something that could be prevented.
Mm-hmm. How was it like working during the global pandemic?
Lots of fun. It's difficult because if you can imagine, the teleconferencing doesn't really work very well for ophthalmology. It's great for psychiatry, radiology, and dermatology maybe, but not for a field where you need to examine the eye closely through the slit lamp, and it's very difficult to get to be able to not miss things and diagnose people effectively and also treat them effectively, which is very difficult.
Yeah. How were you able to help people during this difficult time period?
In many ways, whatever way we can. I was working all throughout the pandemic. I don't think I ever closed. We were doing emergency surgeries. I was continuing with my care. We were going along our business. So doctors should continue working. Doing, emergency room. I was teaching. I was seeing patients in the office. So whatever I could, I was doing my thing. And I also was doing a lot of internal medicine and virology, more than I've ever done since residency, treating and giving antibiotics, giving, all those outside of ophthalmology scope care.
Mm-hmm.
Just providing a lot of consultation, a lot of ear time.
Mm-hmm. Can you give a few words of advice to the people of my generation hoping to go into the medical field?
I think it's always the same. You have to go if you love it. If you don't love it, you don't enjoy it, then it's going to become difficult as you go along. You really have to enjoy the profession to do it, and it becomes more and more difficult as things get more global and more, I guess, less individualized, and it's a lot more hospital-based care and less continuity of care, and no longer mom and pop shops. So you really have to enjoy, but I think medicine is one of those professions that will always be around. You have to feed people and you have to treat them. So those are the two main things.
Mm-hmm. Thank you so much for your time.
My pleasure. Thank you.